Hello, my name is Dr. Hakim Badmus. I'm a consultant orthopedic trauma and spine surgeon, and I'm the medical director for Hospital for Trauma and Surgery at number 16 Water Corporation Drive, Oniru in Victoria Island here in Lagos. I'd like to talk about a common problem that about 7 out of 10 of you have experienced, and that is low back pain. It is something that a lot of people live with. A lot of people almost don't consider it as a problem because they've had it for several years and it has become a part of their everyday life. The world is changing now. A lot of people are sitting by their computers for longer hours and doing work from morning to night. People are now slightly more sedentary in their activities because you can get things done by a click of a button. But the problem that this is causing is that your back is suffering for your lifestyle. And I want to address the common problems that we face in terms of our back and how we can help ourselves. So on an average, you're an office worker or you're a middle-aged person who spends long hours sitting down and doing one thing or the other. And you notice little by little that standing up is becoming a challenge for you after sitting down for long hours. You also notice that being able to walk long distances is starting to become a challenge for you. You need to change your lifestyle. So the first thing in my management of your back problem is my advice on your change of lifestyle. So you need to make sure that you break your sitting while you're walking. Ensure that you sit on the right kind of chairs with a good back support, and make sure that the height between your table and your chair is such that it allows your eyes to have a straight vision to your computer screen. So you don't want to sit on a chair that is so high such that you have to slouch forward, and you don't want to sit on a chair that is also too low such that getting up becomes a problem for you. So that is the first thing that I would advise. The next thing that I would advise is a standing workstation. A lot of companies, IT firms all over the world now have these areas that are standing workstations where you can move around with your computer, with your laptops and everything, and you don't have to sit down to do your work. You can stand up and you can do your work, and you can move around, in a clear, good open space to be able to do your work. I would also like to talk about your weight, because the spine is more like I tell people it's like a flagpole that is carrying a very heavy flag at the top of the pole. So you need to shed weight to be able to allow the spine to stay, without much stress, because it's carrying all that load and it's taking it down through your legs to the ground. And the more weight you have, the more your spine is working and carrying, and the more degeneration would take place faster than you would want it to. So if you lose 5 kilograms, if you lose 10 kilograms, you would feel it. You would start to feel better almost immediately without taking any medication. So you need to do that. I also want to talk about exercises. There are certain exercises that are very, very helpful for the back, and those are core exercises, and they are exercises that strengthen your abs and strengthen your back muscles. You can go to the nearest physiotherapist or to the nearest gym, and they will advise you on the types of exercises that help to strengthen your core. If you're able to strengthen your core, then it helps to shed part of the load that the spine itself is carrying, and that also helps in reducing your back pain. If back pain persists despite all that you have done, then I would advise that you see a back specialist who is going to examine you, evaluate you, and determine if you need something further. You would have x-rays done, and if the indications are present, you may require a magnetic resonance imaging, an MRI done. And where there's an obvious problem, then attention can be given. You don't have to travel out of the country. We manage the full spectrum of back-related problems here in Nigeria, and we're able to give you the care in the safest kind of environment that you can have it. We train professionals to manage your back, from the mildest problems to the most complex degenerative deformity-related problems.